There is a question that not a lot of people ask at the beginning, and that is, what happens when my appetite comes back? What happens when my appetite comes back? Whether that is when we lower the dose or just we stop medication. What happens then? And for a lot of people, that's the part that makes them so uncertain about their whole wellness journey on a GLP. If you have found yourself thinking about this on your own time, let me reassure you, you are not overthinking it. There is a lot that goes on after things change, whether your body adjusts to the medication, you lower the dose, or you have to stop altogether. See, we've talked about this before, but appetite changes, and that is normal, okay? GLPs help reduce appetite, and they do that by slowing down the digestive system, but it doesn't remove it permanently. Hi, my name is Evelyn. Welcome to Evelyn's Desk here at Live Light, where we talk all about GLP, weight loss in a safe manner, and everything in between. So thinking about hunger and habits when it comes to GLP, we established that the GLPs they decrease your appetite, but it's not a permanent thing, right? So things will change when you change, and that is going to be whether you are reducing your medication, stopping it, or your body just adjusts. If you are in the process of losing weight, obviously talk to your provider, see what plan you guys can come up with. Here at Live Light, our policy is stay on the lowest dose for as long as possible, and then evaluate when things start to feel a little bit different for you. Sometimes, or actually I should say, when patients start to make changes, whether they are getting close to a weight loss goal or they notice that, they want to make a slight change, they are in a good place, they end up wondering, Evelyn, what's going to happen with the hunger? And my answer is, let's keep an eye on it. Everybody reacts a little bit differently. The hunger may or may not come back a little bit stronger than what you were used to, or you may not notice that much of a difference. It might be a little bit of a change. One other factor to consider is activity levels. Are you finding yourself moving more? Are you actually going to go to the gym, and have a consistent routine? A lot of our patients do that. And in those cases, we tell them, okay, go, make sure you're focusing on your protein, make sure you're drinking your water, rest, but notice any changes around hunger. Some patients express feeling a little bit hungry, but being something that they can manage. And this is where routine comes into play, because at this point, most of our patients have come up with a rhythm of eating, and we work towards that. Sometimes it takes a schedule, sometimes it's an alarm, sometimes it's a to-do list, but we always do recommend for people to eat consistently throughout the day. And if your provider or nutrition person has not advised that to you yet, maybe talk to them about it, or you can always reach out to us. But consistency, right? With this, it's consistency over time. If you're not used to eating consistently but are on a GLP, it's okay. You're not alone. This takes a lot of practice. When you start here with us, we start doing those coaching things that will help you to establish that structure. But if you are not, download the GLP Success and Maintenance Guide and start writing down what you are doing on a daily basis. See, the reason why we push this so much is because this structure is going to allow you to safely lose weight, and more importantly, it's going to help you make it easier for you to maintain the weight loss after medication. Sí, en español decimos El chiste aquí es este. So this is the part that you have to take advantage of. While you are on the medications, it's easy because, or things feel easier because the appetite is not quite there, right? The medication is helping you to suppress it. The food noise is out. So you're not finding yourself thinking about, the next snack or the next thing, or that you want a sugary treat. And that is the time to, in order to maximize, in order to get the most out of these medications, that's where you want to go in and build this structure, build these habits of eating consistently, drinking enough water, moving more, because that's going to help you, right? Like we talked about. We prepare because we know that eventually we're going to be off of medication or on a very, very low dose, and hunger is going to be different. We know that it's going to change. We know that the body will adjust somewhat. We know that we're going to be different people at the end of this. And so what do? We prepare, right? We get ready for that. The people that do the best with this are those who prepare, those who get themselves ready, okay? The people who do well long term are the ones who have something in place before the shift happens, okay? They have gotten used to eating consistently. They are used to drinking their water. They are aware of what a portion looks like. Okay, I'm not saying that they are doing this 100% of the time. They're doing it most of the time. And they understand how to keep themselves satisfied, right? Again, we're looking for consistency. That's like, picture it, consistency. Nice and big. When building that consistency, that's where people struggle the most. Trust me, we've seen it. I've seen it. My coworkers have seen it. Because it takes time, it takes effort, and it doesn't happen overnight. So that is one thing that we have helped people to achieve throughout all these years that we've been in the weight loss industry. Because at the end of the day, losing weight is not just about losing weight. There's habits that go into play to make this safe and healthy, while keeping you from being hungry, angry, lonely, or tired, because we don't want that, right? We don't want halt. We just want to keep on moving. And that is the same case whether you are in the process of losing weight and getting to the best shape of your life, or maintaining because you got to the best shape of your life. If you don't feel like you are there right now and you are struggling, feel free to download the GLP Success and Maintenance Guide. The link is below in the description box, or reach out. Book a free consultation with us. We're happy to help you. One last thing. Please remember that when you start something, if there is, for example, in our case, in a health and wellness journey, we know that you start the medication, it's going to have certain effects, it's going to do certain things for you. At the beginning, we know it's going to do certain things for you. In the middle, we know that it's going to do certain things for you at the end. So what do? We prepare. We don't have to live in fear. We can ask the questions, we can talk, we can find out ways where you can be successful and achieve that wellness that you've been seeking. Don't stop. Don't sit there in fear. Reach out.